Crohn's disease shares symptoms with many other conditions, which make diagnosing Crohn's disease difficult. Diagnostic tests are often used to differentiate Crohn's disease and other diagnoses. Symptoms of ulcerative colitis are similar to those of Crohn's disease. Both commonly occur during teenage years and early adulthood. A colonoscopy can be performed to differentiate most cases of Crohn's disease from ulcerative colitis. In patients with ulcerative colitis, the ulcerations present are superficial and involve the large intestine, as opposed to Crohn's disease, where the lesions can occur anywhere from the mouth to the anus and are deep fissuring ulcers. Differentiation between celiac disease and Crohn's disease usually involves blood tests, endoscopy, and biopsy. Imaging is performed to differentiate chronic pancreatitis and Crohn's disease. Similar to patients with Crohn's disease, patients with colorectal cancer have symptoms such as weight loss and bloody stools. A colonoscopy, CT scan, and blood tests are used to diagnose colorectal cancer. A CT scan would show evidence of diverticulitis disease with surrounding inflammation in a patient with diverticulitis. Intestinal infections are diagnosed with a stool test that would reveal the infectious agent. Irritable bowel syndrome would be diagnosed with screening blood tests and show no evidence of inflammation. A biopsy would not show typical features of Crohn's disease in irritable bowel syndrome. A colonoscopy would show mucosal fragility in watershed areas of the left colon for patients with ischemic colitis. An endoscopy or colonoscopy and radiology scans are used to diagnose lymphoma of the small bowel. And lastly, a bronchoscopy is used to diagnose sarcoidosis.